Attorney Millar, good to see you.
You too, Dr. Jenkins.
Good evening, Mr. Brown.
Good evening.
Dr. McDougall that he would not be able to make it tonight. So perhaps we just hang out for a couple more minutes.
I think I see him coming on now.
Hey, sorry, gang.
Hey, Dr. McDougall.
How are you all?
Doing
Forgive
well.
my good. Forgive my tardiness and my title on my Zoom account being a little off, but we'll go ahead and call this meeting to order at 5:01 p.m. on June the 12th for the Durham County Board of Health. So I hope everybody's doing well. Good to see everybody again. It's been a couple of months. Hopefully everyone has had an opportunity to look over the revised agenda and had a chance to look it over. If there are any suggestions for additions or corrections, we'll hear those at this time. Otherwise, I'll hear a motion to accept.
Motion to accept.
I think I heard a motion and a second. Is that right? Okay, good. So if there's no debate, I think we're ready for the question.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover,
Yes.
Mr. Gregorio,
Yes.
Dr. Jackson, Dr. Miller,
Yes.
Dr. Orto,
Yes.
Dr. Silberman,
Yes.
Commissioner Valentine, Dr. Verbeest.
Yes.
Thank you.
Awesome. Thank you. We also have been given our meeting minutes from the April meeting. Hopefully everyone has had a chance to look over that. If you have, I will entertain a motion to accept those minutes or any additions or corrections there.
Motion to accept April meetings.
Very
Second.
good. All right, it's been moved and properly seconded. If there's no unreadiness, we are ready for the vote.
Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover,
Yes.
Mr. Gregorio,
Yes.
Dr. Jackson, Dr. Miller,
Yes.
Dr. Orto,
Yes.
Dr. Silberman,
Yes.
Commissioner Valentine, Dr. Verbeest.
Yes.
Thank you.
Awesome. Donna, have we gotten any reservations for public comments for this meeting?
No, we haven't.
We have not. Okay, so we'll move on. We'll give the floor to Dr. Jenkins for any staff or program recognitions at this time.
I'll be real brief. Good evening to this great board. It's always good to see you and to be in your presence. I will be very, very brief. For the most part, just want to really give kudos, shout outs, and a lot of praise to this public health staff of the Durham County Department of Public Health. Your health director's report will detail a lot of great things going on, but I really want to point out the resilience, the commitment and dedication to public service, particularly during these very trying times when it seems as if public health is being attacked. You will hear in this meeting about cuts and some other difficulties that we're facing at this time. But our mission for public health moves on. So proud to be the health director for this staff and under the leadership team that we have that has been together for quite some time. I just want to say to them, thank you for choosing to stay the course. And thank you to this board for helping to shepherd us through these difficult times. That is all I have, Mr. Chair.
Thank you, sir. Thank you. And we echo those sentiments to the staff of the Board of Health or to the Health Department. All right, so we'll move on with our administrative reports. We have a presentation that Michael Gwendon will give us on the fiscal year of 24-25, giving an overview and presentation.
Thank you.
Mhm.
Chair McDougall, just gonna set up here. As soon as
Sure
I
thing.
can. Okay. And can you all confirm that you see my slide? Okay, good. Thank you so much, Dr. McDougall. All right, good evening, everybody. You are used to this slide at this point. I'm happy to be with you all and tell you, as we are just about to complete the last month of our entire fiscal year, we have pretty complete data for Q3. So that's what I'm going to be sharing on this evening, as well as touching on some of the federal funding cuts that we've seen at DPH so far. So we have 12 slides this evening. I'll go ahead and jump right in. So the Department of Public Health started this fiscal year with a budget of $25,573,054. Through Q3, we've had budget amendments and rollovers, netting a positive $1,447,046. Our Q3 budget amendments included several state grants, as per usual, as well as some local coalitions, including the Duke Community Health and Community Engagement Research Institute. And these items bring our current budget to $27,020,100. Our expense budget is $38.45 million, excluding benefits that the county keeps outside of the general fund. That's a 7% increase from where we started the year. And we've spent $25,268,477, or 66% of our general fund expense budget as of Q3. Personnel costs and miscellaneous contract services remain at the top, as is the case every time I report to you all so far anyways. They make up 96% of our spending, but I will mention a few items that were purchased a few bigger ticket items that were purchased in Q3, including $55,000 worth of long-acting contraception or birth control, almost $50,000 worth of Narcan, a new industrial fridge and freezer for the nutrition division, and $2,500 worth of forestry supplies for environmental health. So I feel like sometimes those little tidbits are a little bit more interesting than the way I'm able to get the data out of the system, and give you a little bit more of a picture there on our expenses operating wise. In terms of revenue, the Department of Public Health has brought in $6,664,155 in revenue as of Q3, making up 58% of our revenue budget. We do have a lag on our revenue, usually several months, and so I'm not terribly concerned about this percentage. We were in a very similar place last year, so I'm happy with this percentage at this time in the year. Our Medicaid collection continues to be strong. $3,155,592 collected through Q3. Grant totals $2,637,062, making up 87% between those two funding sources. Our service fees totaled $391,781. And this $261,000 is probably Medicaid and grant revenue that just hasn't been, at the time that I pulled the data, hadn't been coded and put in its final resting place, if you will. So that usually shakes out with time. As you all know, we've been granted $923,866 of opioid settlement funds for this fiscal year, spread across 3 different projects. As of the end of Q3, we've spent 38% of our budgeted expenses for the year, and we're continuing to see these activities increase as the year goes on and the programs get more time under their belts and kind of hit their stride. We did have a large increase in our community linkages to care programming in Q3. That was for our peer support contracting, and you can see that $103,000 there for that on that first line. Last meeting, Dr. Ray requested some more detailed information about the impact of the recent federal action on our budget. So I've put some slides together here with that information. So these last slides are going to be related to that topic. So the first thing I wanted to share about was our NACCHO grant. So we received a 1-year $100,000 grant back in to begin in October 2023. This was from NACCHO, or the National Association of County and City Health Officials. This grant was to improve vaccine access, education, and outreach through faith-based partnerships specifically. So we were also granted a no-cost extension through May 31st of this current year to finish off this work. On April the 4th, 2025, a request to pause the work was issued. These funds were COVID-19 appropriations through the CDC. And there was about $15,000 of work still left to do at that time. $7,500 of it had already been spent and was not able to be recovered. And in terms of the project impact, we had 1 convening on pediatric vaccinations that had to be canceled, 1 contract with Grace Church had to be suspended, and 1 contract with the Northeast Baptist Church. We shifted that to be paid for with county funds. Then to kind of go over to the state grant side, we had 2 grants that have been impacted recently. AA 716 is quite a story that continues through me sending these slides. We've had there's an update. So even from last week when these went out to you all. So these were COVID dollars that were set to expire also on May 31st, 2025, and a stop work order was issued on March 24th. So at that time, we had $58,936 uncollected. We worked quickly to switch those. We had contract nurses that were being paid from those grants. They were administering vaccines in the clinic, and we quickly switched those nurses to be paid from another grant so they could continue their work of giving vaccines. And we were also unable to, of course, order any more PPE or other supplies to decrease the spread of respiratory illness. And we, kind of assumed that that was the end of it. But this Monday on June the 9th, we received notice from the state that we could proceed with submitting invoices for reimbursement for that period of the stop work order through May 31st after all. So it's back on. So this week was the last week that we could submit anything to the state for that for last state fiscal year at this point. So basically we had our final reimbursement report was due. this week. And so we again quickly pivoted and were able to switch over some invoices back to this grant to be able to pull down those funds to support the work rather than defaulting to county spending. So this one has been a major roller coaster. AA 451 is the other state grant, which is tobacco prevention and control. We received a stop work order on this one on April the 29th through the end of the fiscal year for only the federal portion of these funds. So the program here has been minimal. What the state did was switch the federal portion over to be paid by the Juul settlement funds. So rather than the federal dollars, now I'll say fiscally, it's been, from our perspective, a minimal impact. But in terms of the program, they're with it being funded now by the Juul settlement funds, there's a much narrower scope of work that focuses only on youth vaping. So you will also see that same tobacco AA that I was talking about here at on the third bullet down. The same thing is true here for next fiscal year. So these three are notifications we've received for next fiscal year, which is now because the state fiscal year starts in June. So for this state fiscal year, so far the news is continue that narrow scope of work for tobacco, and that will be paid from by the Juul funds. Additionally, AA 534 that supports HIV and STI testing was cut by 10%, which for our award is $26,755. And AA 825 that supports STI and HIV testing in the county jail was also cut by 10%, which is $19,000, $19,416. Both programs have a subsequent 10% reduction in services. Lastly, I want to mention, I'm sure you all have heard that SNAP Ed funding is currently at stake. SNAP Ed funds our DINE program that I know you all have heard a lot about in the amount of roughly $1.4 million a year. We use these dollars to pay for 13 FTEs in our nutrition division. 12 of them are registered dietitians. DINE has led our nutrition education in Durham since 1999 and is an award-winning program that serves 21 elementary schools, 5 middle schools, 10 preschools, and 10 community sites. DINE has also championed the Triangle Double Bucks program, which has recently provided $277,370 to local farmers, and it puts local food on the plates of residents. So unfortunately, all of this is possibly on the chopping block. And I know Dr. Jenkins is going to add some more kind of big picture insight to where towards this kind of federal funding picture momentarily, but this is where we are as of today. So as always, I appreciate everyone's attention to the fiscal matters of our agency, and happy to take any questions that any of you may have at this time.
I don't see any hands. There's one. Anthony Gregorio. Yes, sir. You have the floor.
Yes, thank you. And thank you again, Finance Director, Ms. Quinden. Very challenging state that we're in. My only ask for that 7,500, why was that unrecoverable? Can you speak a little bit more to that?
Yeah, it was that was because the work hadn't been completed yet. So we weren't able to ask for reimbursement for it since the work hadn't been done. It was in the works for the last couple months.
I see. Thank you very much.
You're welcome. Thank you.
Commissioner Valentine, you're recognized.
Thank you, Chair. and good evening.
Good evening.
So my question is, first of all, let me just appreciate the value that the department brings to local government, being a revenue producing source. But my question is with regards to the opioid settlement funds, and this is sort of helping me with my steep learning curve with respect to the money that is sent to public health, which I think is an appropriate place for it to go. I probably think in out years more money should go, even though the amount of money that's going to be coming in is going to reduce exponentially over the years. I think it's an appropriate space for that money to go. But do we have like community partners with respect to that money, or is that just specifically for the needs of the department? And forgive me if that's a weird question.
Not at all. Not at all a weird question. And the answer in short is yes, we do have community partners. I'm perhaps not the best person to speak on the ins and outs of the program, but I know that there are a handful of community partners that we contract with, particularly to provide the peer support coaching. And that is that's where we had that $100,000 that was paid out in Q3, where my understanding of that program is that there are individuals who themselves have been affected by substance use disorder, and they are in sort of a peer coaching role to individuals in the program. So that whole piece is run by another entity that we work very closely with, and I'm sure there's other. I know there's other community partners that are involved as well. I don't know, Dr. Jenkins, if you have any others off the top of your head that you can include.
Indeed.
Well, I don't want to like slow the meeting down. Like that's something that Dr. Jenkins and I can sort of discuss offline. I just wanted to know as a general proposition, because I think I heard something previously, and I'm just trying to connect the dots to see how how that's working. But we definitely can do that unless you wanted to deal with it right now, Dr. Jenkins. That's up to you.
More than happy to talk to you offline, but just know that many partners, particularly through that partnership, the coalition that we have, Durham tries together. Lots of partners at the table, community linkages care, internal partners to include county EMS. The list goes on. So happy to talk to you about it offline.
Okay, thank you so much.
Absolutely.
All right. Any other questions or comments from Micah?
Yeah, I've got one
All right, go ahead.
question. Micah, first, thank you very much for putting that detailed information together. Very, very helpful and comprehensive. And my question is with, and Director Jenkins, perhaps you're going to speak to this in a moment, but with respect to the SNAP dying funding that is at risk coming up, number one, how is that, if you could just help me understand sort of where that is at risk? Is it in the current budget process that's going through? And are there things that we as a board could be doing to advocate on behalf of our representatives to help them understand how important this program is? Or can we somehow partner to partner on what you're already doing to advocate for that program, and we can help to promote that as well?
I will just say a little bit of all the above. Again, thank you for the question, Vice Chair Ray. It goes without saying, the slide that Micah presented with all the great things that Dine has done, it's just mind blowing to think of what could be if it's not in Durham or throughout the country. I give all credit to the members of our Dine team under the leadership of Rachel Elledge. They have mobilized like you would not believe. They have been engaged by Commissioner Wendy Jacobs, and much props to our Board of County Commissioners. They have sent letters to Senator Tillis, Senator Budd, advocating for these funds not to be cut, providing evidence-based data, awards, all that stuff to our elected officials. So to answer your questions, a lot has already been done. What this great board can do, collectively and individually is just the same. Contact your congressmen, your senators, and just advocate for these funds not to be cut. In addition to Medicaid, but we have received word in the spirit of honesty and transparency. We have received word today that the SNAP Ed cuts are within the Senate's budget. And that's not good news, but it is the reality that we're facing right now.
Mhm.
So now is certainly the time for us to, call and to advocate and to really do all that we can. But again, as I aforementioned, our team here at the Durham County Department of Public Health has been very, very active on social media. They've been very active within their communities, both professionally and individually. Certainly want to give credit to Dr. Alicia Smith, our PIO, who has also been very active on social media promoting the Dying Team and all the great things that it do. But I would just say those are some of the things that you can do right now before the budget is passed. I mean, I know we have still got a long way to go before things are final, but those are some of the things you can do, Vice Chair Ray and other members of the board.
Very helpful. Thank you very much.
Thank you. Dr. Silberman, I see your hand. You're recognized.
Okay, I just want to take myself off mute, sorry. I just wanted to follow up on the question that Dr. Ray and Dr. Jenkins were just talking about. The House has passed its budget. They do have in Congress, which is what we're talking about, not at the state level. They do have significant cuts both in Medicaid and in the food stamp program, including SNAP Ed. It is in the Senate right now, and it's unclear how quickly they're going to decide. I've been hearing that it's going to be soon. And there's a big push to try to get it through the Senate. So if anybody is interested in doing something, they may want to think about doing it sooner rather than later in terms of contacting our senators.
Thank you. Any other comments or questions from Micah? All right. Well, thank you for all of the questions and comments regarding the fiscal year presentation. And moving right along in that same vein, we're going to give the floor to Dr. Jenkins to give us a funding update, a federal funding update.
I'll be real brief, Mr. Chair. And again, to the members of this board, thank you for all that you do in support of us. Micah has covered a lot, but as this board knows, in addition to my day job as the Director of Public Health for Durham County, I'm also the Association of North Carolina Health Directors President. And that has been an arduous task given this current volatile but dynamic environment. It has allowed me to go throughout the state to really cheer on and to really hear what is going on and what is being done to advocate for these public health dollars. It also gives me an opportunity to really interface with the North Carolina Department of Public Health a little more than I care to, but we are meeting probably twice, thrice a week, whereas we normally meet at least once a month. And with that, it's provided me with a little bit more of a deeper dive and more insight as to what's really going on with the federal picture. When it comes to funds that we get from the CDC, it's been told by me that the CDC has been sort of like getting funds piecemeal to them. So whereas they would just get a heavy tranche of monies, the CDC is getting monies on a month-to-month basis. And oftentimes it is not enough to cover all of their expenses and all of their obligations. So therefore, we have no other choice but to be at the mercy of them when it comes to all the AAs and all the grants that we receive. We are literally at the point, as I articulated to our fine staff last Thursday, we are at the mercy of the federal government. There are thousands of funding streams and cycles and grants that the Department of Public Health manages. So suffice to say, with this being June, we're not nearly close to being through all of them, but we're not going to know the true picture of where we are until they're able to really see what's all coming. So it's almost like we're in a free fall, but we've not reached rock bottom just yet. That was a description that was given to me by the deputy director of DPH to really articulate how this federal funding cycle looks. And it doesn't look good. We continue to, as I said to Dr. Silverman at the onset, we feel minor abrasions right now. We have not really felt significant cuts. And that is where I lean on Micah Gwendon, I lean on my leadership team to really have a plan of action for how we can sustain this. But the fact of the matter is to this board that some of these cuts that we are anticipating will certainly not be sustainable. What we're used to doing in public health is just really kind of moping along and finding ways to do the impossible with very little. But we've never been in a position where we just can't do anything because we just can't get the funding. So with that, we continue to meet. I will give credit to the state before anything is communicated to the masses. In other words, all 86 local health departments, they meet with us. They get the clearance from us, and us is the executive team of the North Carolina Association of Local Health Directors. And then we approve that messaging. So that gives me an opportunity to give Micah a heads up, like, hey, this is what's happening. This is what's going on. And that in turn gives us an opportunity in Durham to better position ourselves for the blow. But as I mentioned, I just said, I just wanted to let you all know that the federal picture does not look good. We are doing the very best that we can. I think once the federal budget is officially passed, then that's when we can really prepare ourselves for that major blow that's to come. But with that, happy to answer any questions you may have. Dr. Silverman.
Oh, I'm still on mute, off mute. Good. I really appreciate that update, and I know that everything is in flux, so we're not going to know anything for sure until the budget is passed. But there are other things that are happening at the federal level that also have significant public health implications, like the fact that our Secretary of HHS at the national level just fired everybody in the Advisory Committee for Immunization Practices. I would love in the future just to have sort of a laundry list of things that we're keeping our eye on, not just the federal budget, but that have significant implications for us. Like if ACIP, a whole new team comes in and they decide nothing should be recommended anymore, then all of our money for the Vaccine for Children's program goes away. All of the insurance coverage for the mandatory vaccines that all of us with private insurance we would no longer have potentially. So there are a lot, as I said, there are a lot of public health implications that I'm not even aware of because I don't follow all the different things. That it would be great, even if we don't discuss it every time, if we could get a handout that helps us understand what those other issues are that we need to be keeping aware of.
More than happy to provide that to this great board in the interim as updates as I receive them. But you're absolutely right. Again, ACIP, not just that, we're talking about disease monitoring, of course, all things measles and other emerging issues. But I will say that to this board, please don't think for a second that we're not monitoring them. Under the leadership of Dr. Jeff Jenks and our epidemiology team, we meet regularly to really discuss. We have never stopped meeting since COVID to really discuss, emerging communicable disease threats. And that's some 5 years straight. So I will say, again, we want to make sure that this board knows that we're keeping track of those things, and we will be more than happy to produce a one-pager just to kind of let you all know exactly what we're monitoring. Thank you, Dr. Silverman. Thought I saw, Dr. Verbees.
Yes. Interesting times, certainly on all fronts. One thought that I've had is around messaging. So when we get to, I think talking about free falling is exactly how I feel in my job as well. But I've been thinking about how do we message to the community or kind of what these implications are. And I don't know how to do this, but I was thinking that it might be important, depending on what that looks like, to be able to make some statements or to stand behind you in making statements, or, offering suggestions to community as to what they can do to keep themselves and families well. So I don't know, that's just been playing in my head as we're trying, and it's difficult as we're trying to figure out what it is. It's difficult to even plan on the messaging, but I just wondered what you all were thinking about that.
I will say, thank you for that question, Dr. Verbies, and to this great board and to you, I will say, and Dr. Alicia Smith, I trust her messaging for times such as this and throughout the whole pandemic has been nothing less than stellar. She has received rave reviews for her ability to really articulate what is evidence-based and factual and what is misinformation. She lets me know when I need to go in front of the camera and give large-scale messages to the Durham community. And with the help of County PIO, I've been able to do that effectively for the past 5 years. As Dr. Silberman has indicated, it's a little hard to do right now because things are still in flux. But at the same time, I do personally follow Dr. Alicia Smith in the Durham County Department of Public Health on social media, and I can attest that, not that I'm checking up on her, but I can attest that the information and the messaging has been nothing less than stellar, particularly about the SNAP cuts, particularly about the termination of ACIP, particularly about, a lot of different things that have, significant implications. So I know Alicia's on here. Keep me honest. I know we're on Facebook, we're on Instagram, we're on Bluesky, I think that's what you call it. We're on most of your major social media avenues, and she does a marvelous job. But again, she's not giving me the thumbs up to say, hey, it's time to have a more broader message. I think the last time I did it most recently was to really talk about measles and to really get the community to understand the dire implications. But we certainly are one, Dr. Verbies and others, that, we believe in messaging. We believe in putting out evidence-based information to protect our community. Thank you so much again for that topic and that question.
Hey, Rock, can you all hear me first of all?
Yes, we can hear you now, yes. Alicia.
Awesome. One, thank you, first of all, for all the praise. I really do appreciate it. And to confirm, yes, we are on Instagram, Facebook, and Blue Sky. As for the messaging, it is part like what he said, like we don't really know yet, but I will say we have state PIO calls every month. And we have talked heavily about how to communicate about the cuts specifically. And kind of where the state landed is they've created stuff that is more advocacy based, but that the advocacy stuff that's like, call your senator, the cuts, this is what's going to happen. I asked specifically today because I'm like, y'all made this, but you're not sharing it. What's going on? So they have stuff that they've made that they are sending to community organizations and to partners and to people like you all that you can share, saying, here's what the cuts specifically will do, what they are sharing from their channel. And I mean, you could probably think through the reason they're only saying one thing and sharing one thing, but for their channel, they're doing here's what Medicaid does, strictly informational, not so much like call your senators. But I can share that if you all would like resources like that, because they made a bunch of stuff. They made it for Medicaid. I asked about SNAP. They said they haven't yet, but they would like to. So we're also following the state's lead as far as our channels. Like most of the stuff we're sharing is just informational. It's not so much actively call people. It's just saying, here's what's going to happen. But so we're following their lead, but we're also able to share resources with partners if you want more specifically cuts based graphics and things like that to share. So hopefully that made sense. Sorry for noise. I'm driving right now. I've got to save my dog from daycare. So, but any questions?
No questions. I'll just say, number one, thank you so much, Alicia, for all you do. And anything that you're able to share, please just send it to Dr. Jenkins and or to the board. And I think all of us would be appreciative to at least have it in our possession.
Sure. I can send you all the kind of toolkit they made for Medicaid cuts. They have really specific information about who would be impacted and things like that. And I'll try to find also the stuff they're sharing that's just informational. And hopefully the SNAP specific stuff will come soon. Like I said, I asked about that, but that was just this morning, so I don't know what their timeline is. So if I see it, I'll share that with you as well.
Awesome, thank you.
Dr. Chair, Mr. Chair, I'll just also say that most recently, our Board of County Commissioners met with our legislative delegation last Friday, and they articulated, some pertinent information as to the impact that all of this activity will have on Durham, particularly with DSS and public health and other ancillary departments. So just wanted to make sure that this board knew that as well.
Thank you. Thank you.
Thank you for highlighting that, Dr. Jenkins. I was going to mention that, but most of the information seemed to be conveyed, but I appreciate you doing that.
Absolutely, sir.
Definitely some trying times, but we certainly thank you, Dr. Jenkins, and your awesome staff for leading us through this, and your work with the North Carolina Association of Local Health Directors. So thank you so much. All right, so we'll move on to the next agenda item, which gets right back to Dr. Jenkins. We'll give way for the health vacancy report for April and May of 2025.
Holding steady to this great board, holding steady in the 12% rank, which is on par with the vacancy rate for the entire county. We're not satisfied with that. We certainly want it to be a little bit lower, but please don't let the numbers deceive you. We've had a number of retirements. We've also had a number of promotions, which also creates some vacancies. But I will say, by and large, we're continuing to do well. The Durham County Department of Public Health continues to be the employer of choice. We have a good thing going here, so we do have vacancies that are being filled, and definitely want to give credit to the leadership team. They know in these trying economic times, it's imperative to not waste any dollars, not have any lapsed salaries. So we do our absolute best to review vacancies and to fill vacant positions as soon as possible with the awesome help of our Human Resources Department. Other than that, that's all we have.
All right, thank you. Thank you. Mrs. Salter, we'll give you the floor to review the NOV report. So looks like a pretty lengthy one, but I'll let you discuss that with us.
Yeah, it's a 2-month report, April and May. Unfortunately, we were not able to remove as many as we added by far, but there's nothing really earth-shattering on there. And there has been a couple of positive updates since we submitted the report. We were able to get one of the older NOVs removed just this past week, and that's always a good thing. And one that we had to issue to a school is well on its way to being corrected, which is very good. And that's all I have, unless somebody has a question about a specific NOV.
Don't see any questions. So thank you, Mr. Salter, for that update. And we'll once again give way to Dr. Jenkins for the Health Director's report for April and May.
Thank you so much. And again, it's always very tough. I know I say it all the time, but it's always tough to highlight a few of the great work. I will not belabor the topic about DINE, but we know how great our DINE team is. They have 2 entries inside the Health Director's report, particularly around advocacy, trying to get this board to understand the dire need for them to advocate for them. But we also had our second annual ACEs Childhood Experiences and Resilience Conference, if you will, trauma-informed conference, under the leadership of Jess Rhodes, who is the former ACEs Childhood Experiences Resilience Coordinator. She has just been promoted, and we are happy to be filling that position. But again, in partnership with Durham Technical Community College and many others, originally scheduled February 19th through 20th, had to kind of deal with a setback. But again, we did end up having it here a few months later. And with that, we were able to deliver a very good conference that centers around working with adolescents who've experienced trauma, migration and trauma, working with immigrants and refugees, trauma, mental health and substance use, and trauma-informed care 101. the work that Jess has done in this space for this agency and for this community has been nothing short of phenomenal. So again, we wanted to highlight that. Marissa Mortarboy is our Population Health Division Director, and she has embarked upon a very, very unique, report or historical report that really deals with Durham's health and history. I've been the recipient of a lot of proofreading, some 30 to 40 pages at a time. But I will say it is rich in Durham's history. It really talks about, from a historical perspective, our community health needs assessment, how we have gotten here to this point from the 1500s in Durham on to the present. So again, this complex, comprehensive narrative really factors in the impact of health and provides up-to-date data related to our community health needs assessment and our priorities. So I definitely want to shout her out within this health director's report, because when it's finished, I do believe that it is going to be a magnificent document that I certainly want to make sure that this board is able to get their hands on for their edification. Again, along those same lines, in her division, the community health needs assessment process has begun in earnest for our next iteration. They have been really off to the races. We have been fortunate to be able to collect many surveys, probably the most that we ever have. Right now, at the time of this publication, we were at 700. As it stands right now, we're well over 1,000 surveys that have been collected. We are competitive. We want to outdo Wake County, and I'm pretty sure we will. But with that, this really informs, it centers around our 5 health priorities. It centers around our community health improvement plan. There's three surveys that are being done, which is our Comunidad Latina survey. There's our general survey, and there's one at the request of the community to do a survey on the Black or African American experience. So again, shout out to them. And the last thing I want to say as an update that's not in here is that we have a mobile unit. We were successful in securing our mobile unit, and I want to say it was probably 2 Fridays ago. So we have a rolling public health department that has been years in the making. It's some trials and tribulations that we faced in terms of the manufacturing delays and funding and making sure that we get it all to align. But I am hopeful at the meeting that you will attend in person that we will have it outside of the local of our agency for you all to board and to be able to see. The purpose is to really extend our reach. I have had conversations with Superintendent Dr. Lewis to let him know that we are looking forward to partnering with Durham Public Schools to ensure that the kids are vaccinated. We're looking forward to community events in which we can show up and to really extend our reach. We're looking forward to using geomapping and data to hit those hot spots to really take public health to the streets. So I just wanted this board to know that it was money well spent, and I am honeymoon happy and peacock proud to have it. That is all I have, Mr. Chair.
Awesome. Wow, that's exciting to have a mobile unit. I might have to sneak by the health department to take a look.
It is
even
nice.
before the
It is
fall
really
meeting.
nice. It is really nice. It's a tricked out Winnebago. You will love it.
Awesome. Very good. Very good. All right. Well, we will move. Thank you, Dr. Jenkins, for that update on the report, the health director's report. We have a question. Dr. Silberman, go ahead. Sorry.
Just a quick question. When do you think you're going to have the results done of the surveys that you've been doing, so we have a sense of when we may see that?
That's a good question. I do believe that it will be done toward the middle or latter part of 2026.
Awesome.
Thank you.
Okay. Any other questions for Dr. Jenkins regarding the health director's report? I'm sorry. All right, I don't see any hands, so we'll move on. I'm going to ask Commissioner Valentine to come off mute to present the letter of support to Senator Thom Tillis, if you would.
I actually don't have that right here in front of me.
Okay.
So if you can come back to me.
Sure.
Okay.
Or Dr. Jenkins, if you wanted to. Yeah, but we can certainly come back to you. So we will, we don't have any committee reports or old business for today. So I will entertain any suggestions for new business to be discussed at our August meeting or presentations to be given. I see Mr. Gregorio's hand up.
Yes, thank you, Doctor. Just a suggestion for perhaps the next topic. I mean, especially with summer, right upon us, and the kids being out of school. I'd love to see what our great, public health department is doing to interact with the community, especially with, like health related illnesses and really just prevention, some sunburn and whatnot, and aquatic safety. With our continuous outreach, just want to make sure that we're always ever present with our community, and especially with our new mobile unit. I think that's really fantastic.
More than happy
All right.
with that, Mr. Gregorio. Thank you for that suggestion.
Very good, Dr. Silverman. You're recognized.
Hey, thank you. I know that it will probably have it anyway, but I just want a reminder that I'd love an update also when the state passes its budget, what the implications will be, not just what the feds do.
Consider it done, Dr. Silverman. Happy to do that for this board.
All right. Any other suggestions for topics for the August meeting? All right. Well, before we go into closed session, I'll see if Commissioner Valentine has that letter from the county commissioners pulled up.
Chair, I'm trying to pull it up as we speak. Obviously, I'm familiar with it. I was a signator. It was initiated by Commissioner Jacobs, but I'm having problems getting back into my email. So,
Where's Dr. Jenkins? Did you wanna?
More than happy to. Again, we're just thankful.
Thank you, Dr. Jenkins.
We're just thankful for the Board of County Commissioners to not only allow us to time on their agenda. I want to say it's probably about a month ago to really speak about SNAP Ed and our dime program, but also to take action. It was Commissioner Wendy Jacobs who spearheaded these activities, and again the letter to Senator Tillis was just really a call to action, really articulate the finer points of what SNAP Ed does inside the Durham community, how many lives it teaches, how many lives it touches, double bucks, farmers markets, all of that information that we're just hopeful that would be considered in their decision-making process. Although it doesn't look too good, it's definitely enlightening, and certainly we're gracious that the Board of County Commissioners did that. In fact, again, as president, certainly of the association, used that to really send throughout the state as a template for other county boards of county commissions and boards of health to use in their advocacy efforts as well. So again, to Commissioner Valentine and others, we just thank you so much for your support, and we continue to keep hope alive. We certainly know that any actions negative toward the dime program is going to be devastating for the community.
Thank you, Dr. Jenkins.
Yeah, thank you, Dr. Jenkins, for that. And let me just add, I would have liked to have read the letter in toto, but I did have an opportunity to reach out to our representative, Valerie Fouché, and actually I talked to her once at a social setting, and then also had the opportunity to reach out to her. And so she is fully abreast of this issue. She's tracking it. And I told her I thought it would be a good idea to talk to folks who are on the other side of the aisle regarding these issues in person as part of our delegation federally. I thought that would be important to ensure that these funds weren't lost. I'm scared for our community in the event that we lose these funds. The county would be the safety valve in not only this issue, but other critical issues. And so I'm hoping, maybe against hope, that these programs aren't critically reduced. So thank you, Dr. Jenkins, for stepping in on that.
Thank you, Commissioner Valentine, for the work that you're doing as an elected official to help to try to mitigate some of these cuts to these very important programs that we have. So, all right. So if we don't have anything else in the way of new business, I will entertain a motion to adjourn into closed session pursuant to North Carolina General Statute 143-381.11A3 to discuss the health director's fiscal year 24-25 performance evaluation.
So moved.
Second.
It's been moved and properly seconded. If there's no debate, we are ready for the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover,
Yes.
Mr. Gregorio,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Orto,
Yes.
Dr. Silberman,
Yes.
Commissioner Valentine,
Yes.
Dr. Verbies.
Yes.
Thank you.
Thank you. So I guess we will get moved into a closed session Zoom room.
Yes, let me,
Is that correct?
I think we're working on it now. It's still being worked on. If you hold on just a moment, please.
Yes, ma'am. Thank you. Very good. I think we're all back in our regular session. There's Commissioner Valentine. Do we have any closing remarks from anyone before we entertain a motion to adjourn this June meeting of the Board of Health, Durham County Board of Health?
So, Chair, I want
Yes, sir.
to compliment the manner in which you run your meetings. And so, as you can imagine, I'm a part of a lot of meetings.
Sure.
So, the manner in which you get these meetings started, you facilitate, and you get us out. So, thank you for that. It doesn't go unnoticed.
Thank you, sir. I appreciate that. All right. Any other comments before we entertain that motion to adjourn? All right. Seeing no hands up, I will. I'll entertain that motion. Has anybody made a motion yet?
Motion
to adjourn.
Second.
It's been moved and properly seconded. If there is no unreadiness, we are ready for the question.
Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover,
Yes.
Mr. Gregorio.
Yes, and enjoy and have a safe summer.
Thank you. You too. Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Orto,
Yes.
Dr. Silberman,
Yes.
Commissioner Valentine,
Yes.
Dr. Verbees.
Yes.
Thank you.
All right. Thank you. Everybody have a great summer. Congratulations again, Dr. Jenkins.
Thank
And
y'all
thank
so
you
much.
for all of your hard work.
Thank
Bye.
Everybody.
See you
Thank
all in
you.
August.
Take